Today we are doing an Agnes procedure for the jowls. So Agnes is microneedling with radio frequency, and what happens is we insert the needle into the tissue, and then when we push that pedal, it releases the radio frequency, which is a heat that kills fat, which we love to kill fat. So there's not many treatments that can actually do that, and Agnes is one of them. So we can treat wherever you have extra tissue, such as jowls, submentum or double chin, even under the eyes. If there's fat pads that are herniating, we can get rid of those with Agnes. You can treat above the knees, inner thighs, anywhere there's extra tissue, you can do this treatment. Everybody is a candidate unless you have some metal in your body in the area that we're treating, or if you have a pacemaker or defibrillator. Really, you can't really do much in terms of aesthetics if you have any of those. But what happens is we have you do this treatment once, we have you come back in 3 to 4 months, and you do it again. We might need even up to 3 to 4 treatments. It depends on the results that you're looking for. Often we combine it with Scarlet, which is also microneedling with radio frequency, but what she does is she helps tighten and lift. So we're killing fat with Agnes, and then Scarlet comes in like little Cinderella and tightens and lifts. We recommend doing a Scarlet with each Agnes and in between Agneses as well. So typical course would be Agnes with Scarlet today, come back in a month, do Scarlet, come back in a month, do Scarlet, and at the 3-month you do Agnes and Scarlet again, and a couple more Scarlets. So 6 Scarlets total and 2 to 3 Agnes. After this treatment, she'll have some bruising perhaps, less bruising if she did Scarlet right afterwards, because the radio frequency from the Scarlet will help coagulate any area of bruising that might be happening. And we'll put some bandages on her to help calm the inflammation, and then she'll start to see results in the next couple weeks and final results in 3 months. So that is Agnes, and you should come see Brooke.
Yes.
Yeah, and she can help find out if you are a good candidate. If you want to learn more, you can find us online at RejuvenationMD, medspa.com.